good evening. So, still June 5, and it's 8:59. So I had my swabbing like 8:48 in the morning, and it's 8:59 tonight. So, we're gonna go and check now kung anong result ng aking test. So I'm opening the app now. As you can see, immune by first dose. I don't know why. But let's see the test result. Oh, so that's why. Kasi it is still pending. I don't know why. It's like more than 12 hours na. Pero let's see. By midnight siguro. By midnight. Kasi if last parang by midnight nga kasi right now I'm checking. Ito yung back in July of last year. If you will see, nakalagay doon yung test date and then test results. Tapos nakalagay doon yung pati yung time. So if you will see, teka, malabo kasi ang mata ko eh. Test date was July 25 at 10:17 in the morning. Result date was July 26 midnight. So every midnight yata ang labas ng results. Like this one, the one that I did last week, test date was May 31st, 6:38 in the evening, and then result date is June 1st, midnight. So, ayan. So, mamaya pa yan. Mamaya. So, babalikan natin yung symptoms ko. It's still the same. Nothing has changed. Wala naman akong difficulty in breathing. Walang fever. Walang no sore throat. No pain sa back or sa chest. No body aches. Sometimes daw merong diarrhea or what do you call this? Stomach ache, wala din. I don't have headache either. So basically yun pa rin yung sa ilong ko at saka dun sa medicine naman na tinitake ko for cough, nawawala na yung itchiness. It's just that siguro by tomorrow I will stop taking it now kasi having palpitations. So naka 2 doses lang ako today. Pero magsa-stop na ako. The last time that I took it was 5 in the afternoon. Magpapabili ako ng bagong gamot for tomorrow. Pero it's really effective kasi hindi na ako muubo, hindi na siya itchy, my throat is no longer itchy. It's just that I get palpitations and sobrang sobrang nakakaantok na hindi ko mapigilan yung antok ko. Anywho, I have prepared here something sana that I wanted to discuss nga related to COVID pa rin. Pero sige, discuss na natin yung how things are here sa Saudi Arabia, how the government is ano yung mga bagay-bagay na COVID related dito sa Saudi. So Um, Number one, dito, we are not required to wear face shields. Um, we are only required to wear face masks at all times, except during, syempre pag nasa loob ka ng house mo, or kapag ka nasa restaurant ka and you're going to eat. So, actually parang sa park allowed din yun as long as you don't have the mask kasi kumakain ka. Pero let's say you're not eating, hindi allowed yun. Tapos, in terms of drinking naman in public places, hindi siya allowed na if you wanna drink something, you should go inside, not outside, not in a public place. So, para maalis mo yung mask mo and you will be able to drink. Of course, there will be, what do you call this, exceptions like emergencies, but yun, basically, that's it. So, anong penalty if you are caught not wearing the mask? Before, I think, on the onset of pandemic, last year, the penalty is 1,000 reals. Ayun. So, 1,000 real penalty for not wearing mask is equivalent to something almost 13,000 pesos, Philippine peso. And then that's for the that was last year, and parang may mga number of offenses that you're allowed. Parang one time lang yata. And then if you're an expat, the second time it will be doubled, and with the possibility of getting kicked out of the country, deported. Pero recently, this year, they raised it up to, guess how much? Ayan, may zoomies. May zoomies yung sineknek. So anyways, yun nga. This year, they changed it to, drumroll, 10,000 reals. So that's around 130 Philippine peso. Just for not wearing mask. Tapos parang, I don't know if it's sa first offense pa lang may possibility na of meron ng probability of deportation, or it's on the second offense. Tapos, also dito, yung app na pinakita ko kanina, the application that we're using, actually parang, I don't know, parang natitrace din yata nila kung nasaan ka or something like that. But anyways, or I don't know if it has something to do with a national ID or something. Pero they will be able to track whether you're breaking your quarantine or not, or your isolation. So, ano naman yung penalty for breaking quarantine or breaking isolation? In terms of money, ang penalty is 200,000 reals. Yes, guys, 200,000 reals. That's roughly about 2.6 million pesos just for, breaking your isolation. So, if you remember earlier, I was discussing about the color codings in the application. There's the orange color code, which means that you were exposed to someone who's COVID-19 infected, but you are allowed to go out. You're allowed to go out, but you're not allowed to go inside any workplace or any enclosed public place. So, ang difference nun, if you become brown or infected, is you are not allowed to go out of your house or to go out of the quarantine facility where you're at. So, pag lumabas ka, you broke your quarantine or your isolation, you will be charged 200,000 reals. And the thing here is that dito, they do not go like, they do not go after you na bibigyan ka ng letter or whatsoever. It just appears in the application. We have this other application that we call Abshir. One second, I will show it to you. So we have this. Oh, it doesn't show a lot. Ayan. Nandito lahat ng records ng lahat ng tao. Or let's say, I'm just gonna go and discuss about expats. So, nandito lahat ng records ko. Residence ID, for example, driver's license, car registration, anything traffic-related violations, or if you have dependents, nandun din yung records nila. When your records of going in and out of the country, up to the last second, nandun yun yung date, hour, minute, second, nandun yun, makikita mo lahat. So, also phone number, dito you cannot, you can have, I think, up to 4 or 5 phone lines under your name, but all of them have to be linked to your ID. Your bank accounts are linked to your IDs. You only have one ID. So everything goes back to the ID. So hindi siya, it's not a very easy thing, yung mga violations and everything. It's not very easy to avoid them or to not pay them kasi lahat siya linked. So any violation, papasok siya dun sa Abshir account mo, you will be notified even by text message. Kung halimbawa you'll be having all of these excuses like, no, I wasn't checking my Abshir, I wasn't checking this and that. Nope. You will even get SMS message kasi nga linked yung phone number mo sa EKAMA mo. EKAMA, we call that EKAMA, the ID. So, yun. So, walang takas. Ngayon, another question, another thing that I want to discuss pala is, ano ngayon, these past few days, since nagkaroon na nga ng vaccine, nag-roll out na rin ang vaccinations dito sa Saudi Arabia, ano naman ang requirement ng government ngayon that is related to vaccine? So, initially, parang I think it was in January or February, nung nagkaroon ng yung unang-unang rollout ng vaccine dito, it was purely voluntary. So, option ng tao if you want to get the vaccine or not. And it's free. It's provided for by the government. So, nasa yun. And then, I think, a month ago, I'm not so sure, just a number of weeks ago, nagpalabas sila ng order na lahat ng mga workers, workers, both in private and public sectors, are mandated to be vaccinated. So, ngayon, parang ang nangyari, lahat ng mga employed individuals or working individuals should be vaccinated. So, who's left na nagkaroon binibigyan lang ng option whether to get vaccinated or not are yung housewives, students, children, mga walang trabaho. In terms of expats, yung mga holding dependent visas. So, lahat ng mga may work visa sa expats, we have to get vaccine. Then, parang I think 3 weeks after that, another announcement was made that as of starting August 1st this year, lahat ng mga establishments, lahat ng enclosed public spaces, will not be accessible to people who have not been vaccinated or whose Tawakkal na app, that's the application that I was showing you earlier, yung mayroong color coding. So, pag yung Tawakkal na app mo is showing na you are not immune, 3 kinds of immunity kasi, di ba, yung full immunization, immune by recovery, or immune by vaccination. So, pagka kasi immune by vaccination ka, immune by recovery ka, hindi ka pa pwedeng bigyan ng vaccine. You have to finish the 6 months, then tsaka kanila bibigyan ng vaccine kung hindi ka pa na first dose. Pero kung na first dose ka na, tapos nagkaroon ka ng COVID, then after recovery, considered fully immune ka, yun na ang lalabas sa system mo. So, either of the 3, kapag ka hindi yun ang nandun, remember, there are only 2 colors that are allowed nowadays to be accepted into enclosed public places or any establishment. It's the dark green and the green one. The difference is the dark green, you're somewhat, partially or fully immune. So, by August 1st, the green one will no longer be accepted, only the dark green. So here, in Saudi, they're not actually saying na, it's mandatory, you don't have a choice, but yeah, you have a choice. But, if you don't want to get the vaccine, you don't go out. You don't mingle with people. Kasi nga, it's not because the government is, trying to your rights. Pero, actually, the government's trying to protect you. Because, yung vaccine protects you from getting severe symptoms. So, kung hindi ka vaccinated, hindi naman, kasi ang vaccine naman is not 100% guarantee that you will not get the virus. Diba? It's just a percentage guarantee that you will not get severe symptoms if you get the virus or when you get the virus. So, for people who are not vaccinated, you have a high probability of getting severe symptoms. That's why the government here is requiring you to stay at home if you're not vaccinated. So, yun. Yung ako, as far as I glean, yun ang intindi ko. Anyway, moving on. So, nasabi ko na nga earlier that vaccine here is free. No one has to worry about it. No payments whatsoever. In the same application as the one that I showed you, with the color coding and stuff, Tawakkal na app, that's what we call it. Dun din nag-a-apply for COVID vaccine, and then they give you the schedule. Okay, so next thing to discuss is katulad ko, ako halimbawa, I got exposed to someone who's COVID-19 infected. Then I've got symptoms, I got sick. Yung testing is done in 3 ways. The first way is through yung government provided services. Actually, yun yung first and second way. Na-divide lang siya into 2 kasi dalawang paraan siya para makakuha ka or maswab ka. Both are free. and unlimited. I don't know. It's free. So, kumbaga, you can get tested for as many times as you want, or as many times as you need, or feel like you need. So, first option is to go through the same application, Tawakkal Na. You will request for a COVID-19 test schedule. Once, meron lang doon a couple of questions. You will be asked like, have you been exposed to someone na COVID-19 infected in the last 14 days? Tapos, yes or no. Tapos, you will be asked what kind of exposure, how long, saang klase ng lugar. And then you will be asked for your symptoms, and then you will be asked for pre-existing medical conditions. Then, bibigyan ka na niya ng options for the schedule, and then you will be given the QR code and the date and the time that you chose once na-confirm, plus the location of the testing center. So, location link siya, so you can access it using any kind of map, Google Map, iPhone Map, what do you call this, Waze, whatsoever, you can access it. Then, actually dito, once na nagka-QR code ka, let's say, halimbawa, ang schedule ko is, let's say, Monday pa, and today is Saturday. And then, I already got the QR code. Kahit now na, pwede na akong pumunta. Kasi all they do is they will scan your QR code wherein nandun na lahat ng mga information mo, your phone number, your ID number, and everything else. Nandun na lahat yon. Just have to go there, they scan it, then they take your samples, and then you go. And it's a drive-through. So, wala nang papasok whatsoever, bababa, mag-check No, it's a drive-through, as in parang mas mabilis pa ang drive-through doon kaysa sa pag-order sa Starbucks or sa McDonald's. So that's the first option for government provided swabbing. The second one is you don't have to get a schedule from the application. You just have to go to any MOH, Ministry of Health, or they call it Tetaman Clinic. Makikita mo naman sa Google, you just have to look for it sa website ng Ministry of Health. They will provide you with the name of the clinics and timings and locations na pwede mong puntahan for testing. So, yun, that's the second one, and it's also free. So, pwede ka mag-walk-in doon. Now, I'm not sure how, I think the results are also given to you through the application. Dun din siya bumabalik, dun sa Tawakkal Na application. Then, the third one is, what do you call this? By private clinics or private hospitals. Keyword, private. So, it's not paid for by the government. You will have to pay out of your own pocket, and the test fees, which range from 200 reals up to 500 reals, and sometimes maybe even more. It depends on yung class ng private hospital or clinic where you're gonna go to. Yun yung range, excuse me, range ng fees, and it's not covered by health insurance. So, you will have to shell the money out of your own pocket. For the result, it's the same thing. It will go back to the Tawakkal Na app. So, here, you have the drive-through, you have Tetaman Clinic, which both are, Tetaman and drive-through, both are government provided and free of charge. And then you have the private, which you will pay from 200 reals and up. Pero lahat yung tatlo na yan, ang results niyan all go back to the Tawakkal na app. So, doon siya babalik lahat na naman. Hintay mo na naman yung color coding mo. Are you green? Are you brown? Are you orange? Ganon. So, yun. Maganda ang system. Now, yun nga, nabanggit natin yung medical health insurance. Tests are not covered. I think there's a move that's being done recently na i-cover yung tests. Pero as far as I know, up to last week, kasi nalaman ko doon sa isang office mate ko, hindi pa siya covered ng insurance. So, pero what are the things what are the COVID related things, medical, that's covered by health insurance dito? Lahat. It's either your health insurance covers it or the government pays for it. Medicine, yun nga, yung tests as I mentioned earlier, and hospitalization, covered siya. Medicines are covered by insurance for all citizens, for all residents like yun, expats and their families, and for visitors, pero as long as it's prescribed by a doctor. So, halimbawa sa case ko, let's say, I chose to not go to the hospital. Kasi, and just to get, what do you call this? Just to get prescription for the medicine. Malaki yung nasa-save monetarily. Pero since I don't need, I don't need antibiotics or special medicine that will cost me a lot of money naman, I still find it rational to not waste my time going to the hospital. Lalo ngayon na I have flu-like symptoms, and for sure yung immune system ko is lower than normal. Tapos mas lalo akong ma-expose sa hindi ko pa alam kung anong klase ng sakit. Then I have to fall in line and I have to wait for insurance approvals. So instead of, on the average I will have to spend like 3-4 hours in the hospital just to get this. So yung 3 to 4 hours na yun, I would rather rest at home. Mura lang naman ang paracetamol dito, tsaka cough syrup, and basically those are the only things that I need. So I opted to not go to the hospital and get prescriptions. Yun lang. I have other things to discuss here, pero I will discuss them later kasi they are related to the outcome that I'm not actually dreading. I know what to expect because of the symptoms that I have right now. It is a little bit unsettling. So I have been talking to friends and some of my family. Hindi pa lahat. Most of them know yung immediate family ko. I mean, in the Philippines. Except for my dad. I don't know if they've told my dad, but well, at this point, I just don't want to tell him until I get my results, until it's confirmed. Although I'm like 95% sure it's going to be positive because of, again, the symptoms that I'm having. But I just want to be at the 100% sure that it's positive. The thing that worries me the most right now is giving the virus to my children. Well, ako kasi sa akin, yan ngayon na experience ko. I mean, with you know, ever since last year, I've been taking vitamin C and virgin coconut oil, and super careful, washing of hands, observing social distancing, wearing masks all the time as much as possible. We rarely go out to dine. We limit going to groceries to a maximum of twice in a month. And whenever we go to groceries, like you go in, you get your stuff, you pay, and then you go home. So with all of those, taking care of yourself, precautionary measures, vitamins, trying to strengthen your body and your immune system, and then I got the first dose of vaccine. They all contributed. Kaya ako ngayon, even if I am 95% sure that I have COVID, hindi siya masyadong mahirap for me. Again, it's just blocked nose, itchy throat, walang pang-amoy, mahirap kumain, konti ang nalalasahan, but that's about it. So, yung mga anak ko there, kind of like tamad to take vitamins and this. So, and besides, my son is asthmatic like me. So, medyo, yun lang talaga ang worry ko. So, I've been asking my friends and my prayer warriors to pray for us. Mainly para sa mga anak ko. Una, hindi sila mahawa. Number 2 is for me to recover ng ganito lang. Alam mo yun, chill, wala nang lalala. So, I've been meaning to do some vlogging, for quite some time now. I've been, thinking about anong content, how to do it, when to do it, do I have the time to do it, like that. And then this happened. So I was like thinking of, maybe have something good come out of this. So I will be documenting my journey through this situation, and hopefully we all get something out of it. Later.